Let's continue with hypertension. When you know what your MET level change per stage, you have an idea about what your normal blood pressure response should be. Diastolic should change very little, or it might decrease slightly. Systolic will go up approximately 10 millimeters per 1 MET. That gives you an idea, was it a normal or more of a hypertensive response. Table 5.4, let's look at that a second. So table 5.4 gives us our abnormal peak and recovery exercise. So it has our heart rate and recovery. If we look at the second column, men peak exercise could be over 210. Women can be over 190. That's abnormal. Diastolic, more than 10 from rest, or 90 if it's women, or greater than 90 overall. So we have our abnormal peak exercise blood pressure. Men greater than 210, women greater than 190. During recovery, the systolic blood pressure should be at least less than 90% of the peak. And if we have it still elevated, we know that that's an abnormal response. For exercise testing, Table 10.4 gives you some guidelines about what the protocol should look like, what would be measured, and what you're evaluating. So for cardiorespiratory, we're looking at a cycle or a treadmill. The cycle is approximately 3-minute stages with 25 to 50 watts per 3-minute stage, or 17 watts per minute. In a treadmill, there is your Bruce protocol right there, 2 to 3 METs per 3-minute stage. That's Bruce protocol. That is where this author is putting its bend. What will be measured? The EKG, heart rate, systolic and diastolic, the rate pressure product, we'll look at that in a little bit, RPE, and ventilatory gases. And we're looking for signs and symptoms, which would be our cardiovascular, chest pain, burning, discomfort, shortness of breath, dizziness, leg pain, abnormal blood pressure or heart rate, abnormal rhythm, or ischemia. That's what we're looking for on our as the individual is performing the assessment. When do you quit? You quit if the heart rate doesn't go up, the respiratory exchange ratio is greater than 1.1, or the RPE is greater than 17. We also have our standard systolic and diastolic blood pressure medications, and with us to keep in mind. Resistance exercise. Use free weights or machines. We can estimate or determine that 1 RM estimated from a higher RM, so either 8 RM or 5 RM. We're looking for our 1 RM, and we're evaluating for signs and symptoms. And I will tell you that the blood pressure is hard to assess with strength training. We're looking for the individual to avoid the Valsalva. Flexibility, exercise, all stays the same. So remember, our heart rate response should be about 10 beats per minute per MET, and our when we know that if somebody is on a beta blocker, that they're going to have a lower blood pressure response. We also know that we're not going to get our 10 millimeters per MET increase, which means it's blunted. After someone is identified to have ischemic heart disease and they don't have a beta adrenergic blocking agent. And this is diagnostic, that if they don't achieve their 85% heart rate max estimation, that's indicated to be an increased risk of morbidity and mortality. During recovery, we should see a rapid decline in our heart rate within the first minute, and it should be at least 20-ish beats after 2 minutes. That's why we continue to measure heart rate and blood pressure during our recovery, because we want to have our normal response. So how do you treat? Well, one issue is either exercise, healthy lifestyle, or drug therapy. And the drug therapy, already mentioned those earlier in the previous presentation. We're looking for a target of decreasing our blood pressure. The SPRINT, which is Systolic Blood Pressure Intervention Trial, they found a tremendous decline in death and mortality by having a decrease to about 122 milligrams of mercury after 3 years. And so it gives us an idea of how we should move forward. The lifestyle modifications are all going to be related to some of the questions that you're asking during the history, right? So this is where you can ask about the diet and how much sodium that they consume. We can ask about their physical activity. We can ask about their stress level and also their alcohol consumption and obviously their smoking. So the recommendations, what you'll see, is to eat a DASH diet, which is the dietary action to stop hypertension. What that does is puts a dramatic decrease in sodium intake and a increase in fiber, whole grains, and fruits and vegetables. Weight loss is going to be important, and we have an increase in potassium because dietary potassium, if you eat good potassium-rich foods, a banana and a baked potato, I think strawberries are also in that list. Those actually exchange, the potassium exchange for sodium and helps to decrease the sodium load. Physical activity, notice that we have 90 to 150 minutes per week at our heart rate reserve, so more moderate, and dynamic resistance training for recommendations. I'll give you something a little bit different in a bit. And certainly stress management is really key. The recommendations are going to be cardiorespiratory 2 to 3 days or more, 2 to 3 days for resistance, neuromotor, flexibility, and what we want to do, the new recommendations are most days of the week. Most days of the week. If we're looking at the intensity of cardiorespiratory exercise, the moderate or vigorous, and here we have RPE of 12 to 13 or RPE of 14 to 16 on a scale. If somebody's on a cardiovascular drug, their resting heart rate might not be, or their exercise heart rate might be blunted, and so the RPE is a good way to go. For resistance, we're looking at basically beginning at a lower rate but going to a moderate intensity with 8-ish exercises. For flexibility, no difference. Here we have our time for the fit exercise recommendations, 90 to 150 plus minutes of continuous or accumulated exercise for cardiorespiratory. And here we are looking for more volume and consistency, more frequency. The resistance exercise seems to be the more dynamic it is, the better improvement, and static or dynamic stretching, and an emphasis on aerobic and resistance exercise alone or combined with neuromotor and flexibility exercise depending on preference. That's the recommendation. So we're looking at like yoga and Tai Chi, which are your neuromotor types of exercises, can be very beneficial. The post-exercise hypotension, or PEH, is really a pretty incredible response after someone exercises. Their blood pressure drops down, systolic blood pressure is impacted immediately and stays down for maybe 24-ish hours. This is pretty great, and that's why we want to have the consistency of multiple days. If somebody exercises multiple days, Monday, Tuesday, Thursday, Friday, they have that acute, immediate, short-term decline, which is really pretty important. This is probably because of the total peripheral resistance declining, and remember that was what we thought of for hypertension. For chronic, for chronic long-term exercise, when somebody is exercising long, if hypertensive, it has a bigger impact than if they're pre-hypertensive. High intensity exercise appears to be beneficial and seems to be greater at lowering blood pressure compared to moderate exercise, cardiorespiratory exercise. Resistance exercise has the greatest impact if someone is hypertensive. If they're pre-hypertensive, you have to do a little bit more weight resistance training, but we do know that it is beneficial. Greater impact for the non-white population, which is helpful. And also isometric exercise, and this to me would be more for, I think, individuals that don't have quite as much capacity to lift weights. Holding a contraction for 2 minutes, but it's only 30 to 50% the maximum voluntary contraction, and then you have rest in between. That might be, it doesn't have a real big impact, but it could be good for prevention of hypertension. Concurrent exercise means that cardiovascular and resistance exercise are either performed on the same session or close, maybe opposite days. Tends to be very beneficial for blood pressure reductions. There's limited improvement evidence for range of motion, and the neuromotor seems to be comparable to traditional exercise. And in your text, there's a nice figure which shows you the cardiorespiratory, which is the burgundy, the drop in blood pressure associated with systolic and associated with cardiorespiratory endurance exercise on systolic and diastolic. You'll see that resistance exercise has the greatest impact on systolic and diastolic. Yellow is if you do them both at the same time. And Tai Chi is green, and yoga is this lavender or lilac kind of color. So you'll see that you've got benefits for any of those exercises, which gives you an opportunity to work on the exercise that people are interested in. The rate pressure product, also known as double product, is an indication of myocardial infarction, and I wanted to mention to you that rate pressure product is something that we look at for our hypertensive responses. If you have heart rate times systolic number, you get an idea of how much oxygen the myocardium is requiring. And so when you have a real high heart rate and elevated systolic blood pressure, that means that you've got greater oxygen demand. So the relationship between the peak RPP is 25,000 to 40,000. It'd be fun if you figure out your own and see what that value looks like. In the last couple slides are just the special considerations where you have things that I've already mentioned. One thing on this particular slide, that if somebody also is overweight, the caloric expenditure should be the big focus, because when you lose weight, that hypertension, systolic pressures will typically be improved. Avoid Valsalva. Make sure that if somebody's on a diuretic or a beta blocker, that they are staying hydrated and that their body temperature doesn't get they don't get overly taxed with heat. Perhaps exercise inside during the heat of the day. Fans can be really helpful. When somebody is on an alpha or a beta blocker, 10-minute cool down is helpful because they're less likely to have a exaggerated hypotensive response. And we want to make sure that people are aware of how exercise can have an impact on blood pressure post-exercise right away, on how beneficial that is. So in closing, our goal is to look at the lifestyle modifications, encourage people to be more active, and work on keeping, if they're on medications, to stay on their medications and not quit them abruptly.